Hello dear friends. Today we will be learning about the endocrinology. Endocrinology, this endocrinology basically deals with the endocrine endocrine, that is ductless glands, and its secretion that is hormones. So but basically this will deal about the endocrine gland and hormones. So in endocrinology, what you should minimum learn is that first you should know the glands. What are the glands? What are the endocrine glands? And then its hormone. Then you should know the nature of the hormone. Either it is proteinous or steroid derived or amino acid derived. Then you should learn the mechanism of action of the hormones, then its functions, major functions, and increased or decreased condition, what clinical manifestation will lead, that also you should learn in the endocrinology. These are the basic. Beyond that you can study more and more as much as you can. So let's talk about the endocrinology. I already mentioned it deals with the endocrine glands and endocrine glands and hormones. So endocrine gland, this is the ductless gland, then what is the hormones? So before defining hormone, I will mention some characteristics of the hormone, and by that characteristics we can draw the definition. So let's see what it is. The hormone, it is actually the chemical messenger or chemical substance, chemical messenger secreted in a small quantity, secreted in very small quantity, because minute amount is enough to carry out the functions or carry out the messages from one tissue to the other tissues. Since the name is messenger, it will be transporting some messages from one organ system to the other organ system. How, that I will mention later. In very small amount by endocrine gland, that is ductless gland, which is transported via blood stream and particularly act at distant site of secretion. So this hormone can be defined as, in layman term, in simple word, that is the chemical messenger. Obviously chemical messenger, because it is the nature is chemical in nature and function is transport of the message. So chemical messenger secreted in very small amount. And then another feature is it is secreted in the very small amount, secreted by ductless or endocrine gland. Another feature. Next feature is the transported via blood stream. This is the most distinguishing feature, that it is transported from via the blood stream or through blood stream, irrespective of the unlike enzymes that is secreted by the exocrine gland and that is transported through the duct. So, and then another feature is particularly act at distance site of the secretion, means secretion is at under site and action is at a under site, and that site is particularly distant from the site of the secretion. So, this is the basic feature of the hormone. You can define in this way this hormone. So, now move on to the glands. Yes. Moving forward, we will talk about now the glands. Glands, I think you have been studying these glands from the +2 level, so I don't think I have to focus so much on these. You have to remember the name of the gland and then its secretion. So, glands are so I will mention here some major glands and its secretion, and this part of the lecture will include the glands, hormones, and then brief mechanism of action and its chemical nature. Okay, hypothalamus. Next is pituitary gland. Pituitary. Next is the thyroid, parathyroid, gland, parathyroid. Then there will be suprarenal gland, suprarenal. Next is the, I am mentioning here major glands, suprarenal. Then that is the pancreas, like kidney also act as the gland. It has multiple other functions like urine formation and filtration of the blood, you know it well. Kidney, then there will be pineal gland. Okay, I will mention some more gland later. So, now these are the glands basically. Now I will talk about its secretion one by one. So, let us talk about the secretion of the hypothalamus. And yes, also mention the gonads. In case of male, testis, and in case of the female, there is ovaries, and there is even placenta also secrete hormones besides other functions. So, these are the basically glands that secrete hormones. Okay, hypothalamus, this is the basically part of the nervous system, central nervous system, and this also act as a gland. How? Let us see here. I will draw here a rough photo. Let's suppose this is uh, optic chiasma. Optic chiasma. Here somewhere will be mammillary body, and then its stalk will join the gland here, that is called the pituitary gland. This is the stalk, hypophyseal stalk. This is posterior pituitary. This is anterior pituitary, and this is pars intermedia. Anatomically, again this pituitary gland is further subdivided. I will talk in detail in the anatomy endocrine lectures. Now we are focused on this endocrinology, physiology, and it will be equally important and effective in the biochemistry endocrinology. So physiology and biochemistry I will deal simultaneously. Pars intermedia. Okay, and this is the hypothalamus. Hypothalamus. So then I will draw here a capillary bed. And it will divide into the sinusoids. And form ultimately the veins or venules. These are the sinusoids. Please remember, sinusoids figure is not so much good. This is primary capillary bed. And this circulation is okay, I will mention here. This circulation is the hypophyseal portal vessel. This is the hypophyseal portal vessels. Now why I drawn this, I will come to that. And then I will draw here one more. So basically I drawn this to show that hypothalamus act as the endocrine gland here. This pituitary is also known as the hypophysis. I will mention that too. Hypophysis. This is hypophysis, and this anterior pituitary is known as the adenohypophysis. And this posterior pituitary is known as neurohypophysis. So remember the common name also. Now I will go to the brief history. This pituitary gland, first when identified, it was found that other glands are under control of this pituitary gland, and hence named pituitary gland as the master gland. But later found that this hypothalamus, the hormones from the hypothalamus control the pituitary gland, and pituitary gland control the other glands. Then the master gland should be this hypothalamus, since it is controlling even pituitary gland, and if controls the pituitary gland, then ultimately it controls the other glands too. Already it was named the pituitary gland master gland, hence the hypothalamus is also called as the master of master gland. So major controller of the endocrine system is the hypothalamus. And why it is called? Because these hypothalamus secrete releasing and inhibiting hormone that control the function of this secretion and function of the pituitary gland. So let's mention the secretion or hormones of the hypothalamus. For it, remember a mnemonics: G cube DCT, distal tubule G cube, means these include hypothalamus. Hormones of the hypothalamus will include growth hormone, releasing hormone, growth hormone, inhibiting hormone. Then it will include gonadotropin releasing hormone. By D is the dopamine. This dopamine is also known as prolactin inhibiting hormone. And then C is the corticotropin releasing hormone. And next will be the thyrotropin releasing hormone. Thyrotropin releasing hormone. So these are the hormones secreted by this hypothalamus. See here, this growth hormone, releasing hormone and inhibiting hormone. This growth hormone inhibiting hormone is also known as the somatostatin. Important MCQ and Viva question. Somatostatin. So these hormones are transported by these hypothalamo-hypophyseal portal vessels from the hypothalamus to the anterior pituitary. Hence secreting the endocrine hormones, so it is the endocrine gland. Now this is the actually hypothalamo-hypophyseal tract. This is the nerve tract. This is hypophyseal tracts. So exception arose here, like what we also earlier mentioned, that this hormone is basically transported through the blood stream, is a again distinguishing character. But the exception is that these tract also carry the hormone secreted by the nuclei located in the hypothalamus. So these nuclei, again you will be asked to name the nuclei. One nuclei is the supraoptic nuclei, and another is the paraventricular nuclei, paraventricular and supraoptic nuclei. So what will be the hormones here? By this paraventricular nuclei, secretion will be the paraventricular oxytocin, and this supraventricular nuclei will secrete supraoptic nuclei will secrete antidiuretic hormone ADH. So again confusion may arise here. The oxytocin and ADH is synthesized and secreted by the hypothalamus, nuclei in the hypothalamus, but if you asked stored and released by, then you should answer this posterior pituitary gland. Remember, synthesized and secreted by the hypothalamus, but stored and released by this posterior pituitary gland. This will be again your important MCQ and Viva question. Now, by all these, what we know, this hypothalamus is acting as a endocrine gland. Here the question will arise. Important question is asked from this gland. Where I should wrote? Okay, I will wrote at top. I will write on top. One question that is very frequently asked is that question is, which of the following is not an endocrine gland? And your option will be number A, let's suppose hypothalamus, B will be pituitary, C will be, let's suppose, suprarenal gland. Suprarenal, it also called as the adrenal gland, you know it. Suprarenal gland, and next will be the pancreas. Now see the question and options. Not an endocrine gland, and all option given, all are the endocrine gland. How meaningless question. No, my dear, it is not meaningless, it is very meaningful question. One rule you should remember while dealing the MCQ, multiple choice questions. You should not look for the correct answer. Yes, correct answer, it should be correct, but that will be given the second preference. First preference will be which of the following is the most appropriate among them. That you should identify the most appropriate option which is, and then you should go for the correct one. So see, these all four are the endocrine gland, but answer will be this pancreas. How? This pancreas also secreting the enzymes, so it is the mixed gland. First preference should go to the pure gland, and then preference go to the mixed gland. So here among them four, most appropriate is the pancreas, because these are the pure endocrine gland. And a student gets confused here. In this hypothalamus, a student take this hypothalamus, but this is not correct. And a student what they think? They think that this hypothalamus is the part of the nervous system. How it can be the gland? And choose this hypothalamus, but that is not correct. It is, you see here, these are secreting these hormones, these hypothalamus secreting these hormones, so it is the endocrine gland. Now we will move on to the pituitary gland. Okay, I will drop this. Pituitary gland. Pituitary gland. Now see here, this secretion, since this secretion is controlling the secretion of the pituitary gland, this will be the master gland. And in spotter, in physiology spotter, you will be asked that there will be given this hypophyseal, hypophyseal portal vessel, there will be given, you will be asked by this figure, you will be asked that name these vessels, you should name these vessels that, and there will be given this tract also, and what you also be asked that, you will also be asked that what are the hormones secreted by these or carried by these portal vessels and this tract, and mention the nuclei. So remember here, oxytocin, it is the short name than antidiuretic hormone. So oxytocin will be secreted by the paraventricular nuclei. Paraventricular nuclei is the longer name. Here supraoptic nuclei is the smaller name. So it will secrete longer name hormone like antidiuretic hormone. Oxytocin will be secreted by the paraventricular nuclei. So from this, spotter is frequently asked. You know it also. Now the pituitary gland. Now the pituitary gland is anterior and posterior pituitary gland. So we will talk about the hormone of the anterior pituitary gland. Anterior pituitary gland. So by name it will secrete the releasing hormone, will convert into the stimulating hormone or simply the hormone. So growth hormone, releasing hormone and inhibiting hormone will control the secretion of the growth hormone by pituitary gland. Growth hormone. Then next will be growth hormone. From the gonadotropin it will be from the corticotropin hormone it will be adrenocorticotropic hormone. Then will be thyroid stimulating hormone, thyrotropin hormone. Then will be gonadotropin will control the secretion of the follicle stimulating hormone and luteinizing hormone from the pituitary gland. Then next will be the prolactin. And you know here how these pituitary gland control other hormones, like growth hormone is it controls the overall growth of the body. Then ACTH, this ACTH control the secretion from the suprarenal gland, and even in suprarenal gland mainly the glucocorticoids will be more affected. Then thyroid stimulating hormone will control the thyroid gland and secretion of the thyroid hormone. This follicle and luteinizing hormone control the gonads, secretion from the gonads, that is testes and ovaries. Then there is the prolactin, it will help in the ejecting milk and development of the breast during the pregnancy. So these hormones are controlling these glands, hence called the pituitary gland as the master gland. So remember these hormones from the anterior pituitary gland. Now posterior pituitary gland. Posterior pituitary gland, you know, it stored and release, store and release, not synthesized and secreted, store and release ADH. ADH, I mentioned about the ADH and oxytocin already in the hypothalamus, and there will be oxytocin. So these are the hormones from the pituitary gland. Now move on to the thyroid gland. Thyroid gland. Thyroid gland secretion is the thyroxine, that is T3 and T4. T3 is the tetraiodothyronine and T4 is the T4 is the tetraiodothyronine and T3 is the triiodothyronine. How this is tetra and how this is tri, I will dealing in detail in the thyroid gland lecture detail. So remember here this only, that is thyroxine. This T4 is also known as the thyroxine. Then there will be the parathyroid gland. Parathyroid gland, what it will secrete? This parathyroid gland, it will secrete parathyroid hormone. Parathyroid hormone. This suprarenal gland, here bit more focus should be given in this suprarenal gland. Suprarenal gland, this has basically, this lies at the let's suppose this is the kidney, then it lies or the upper pole of the kidney, then first outer part will be the cortex and then will be the medulla, adrenal medulla, and even in cortex there will be three part, like it please figure it doesn't mean that upper part is the cortex and lower part is the medulla. No, let's suppose this is the gland, then it will be outer part, its and core part will be there. So outer covering part or some thickness from all dimension, there will be the cortex and inside will be the medulla. And again I will talk in detail in the suprarenal gland lecture. So what I am trying to show here is that this suprarenal gland has an outer cortex outer, and this has basically three parts: zona glomerulosa, zona fasciculata, and zona reticularis. Remember at GFR, glomerular filtration rate, but it doesn't mean that here. So this zona glomerulosa will secrete mineralocorticoids. Then there will be this zona fasciculata will secrete mineralocorticoids. The major mineralocorticoid is the aldosterone, and it will also secrete in a small amount deoxycorticosterone. Then there will be corticosterone and cortisone. See here, not only aldosterone is secreted by this mineral, this zona glomerular layer, but also deoxycorticosterone, corticosterone, and cortisone. And from top to bottom, the mineralocorticoid activity will decrease, and mineralocorticoid activity will decrease, and glucocorticoid activity, from top to bottom increase. Like in aldosterone and corticosterone, if we compare, this corticosterone has more glucocorticoid action and it has more mineralocorticoid action. So these are the secretion from the zona glomerulosa. This mineralocorticoid action and glucocorticoid action from one layer is like one layer only not only secrete the mineralocorticoids, and that mineralocorticoids only not has the mineralocorticoid action, but other secretion also has a corticosteroid action. Means if there will be the hyperaldosteronism, hyper mineralocorticoid secretion, then besides the symptoms, sign and symptoms of the aldosterone, aldosteronism, there will be the sign and symptoms of the glucocorticoids too, since these carry some glucocorticoid activation action also. Okay, I will talk in detail in next lecture this suprarenal gland. Then there will be the zona fasciculata. This zona fasciculata will basically secrete will secrete glucocorticoids, and these glucocorticoids include the major glucocorticoid is the cortisol, and it will again also secrete the corticosterone, then cortisone. Cortisone means besides cortisol action, glucocorticoid action, these also have some the mineralocorticoid action, as these have the glucocorticoid action besides mineralocorticoid actions, overlapping action. And then next will be the I will rub this photo here. Next will be zona reticularis. This will secrete male androgens, and that androgen include dehydroepiandrosterone, and androstenedione. These are the androgenic hormones secreted by this zona reticularis. Now move on to the pancreas. You know this pancreas is a mixed gland. So pancreas, its endocrine part will secrete the insulin from the beta cells of islets of the Langerhans, and next it will secrete glucagon, the alpha cells of the islets of Langerhans, and there one more secretion, it is called somatostatin. Again this will secrete from the delta cells of the islets of the Langerhans, and that somatostatin will decrease the secretion of both glucagon and insulin, and this insulin and glucagon are the antagonistic hormone, that action of this will antagonize action of these hormones. Okay, then there will be kidney will secrete you know also. Kidney, it will secrete from peritubular capillaries of the kidney will secrete the renin, which is important in the renin angiotensin aldosterone axis or system. Then it will form the active form of the vitamin B3, that is 125 dihydroxycholecalciferol. This is the active form of the vitamin D3. And it, again, one more hormone it will secrete is that very important erythropoietin, important function in the erythropoiesis, that is it stimulates erythropoiesis. Then there will be the pineal gland. It's okay, pineal gland. I will talk here only about major glands. Talk about the gonad, testes. What it will secrete? Testosterone, testosterone, and this ovary will secrete ovaries will secrete estrogen and progesterone. Then there will I will also mention here one more glands about the placenta. This placenta also attaches the gland. Then it will secrete HCG, human chorionic gonadotropin, and human somatomamotropic hormone. It will again help in the breast development during the pregnancy. Mammo means breast. And besides this, these will also secrete, this placenta will also secrete estrogen and progesterone, and there is it secrete the arterial natriuretic peptide. So these hormones you should remember. Now I will talk about the chemical nature of the hormone, as I mentioned earlier.